Our patient today is in her mid-50s, and she previously underwent a lift with breast implants by a different surgeon about 6 years ago. At that time, textured anatomic silicone implants were placed into each breast, and her breast was lifted, giving her scars around her areola, straight down and underneath her breast. Well, she is now a D cup, and she feels that they're too large, so she would like to downsize her breasts. In addition to that, she has what's called a waterfall deformity, where the implant is sitting too high on her breasts, making it look as if the tissue is falling off, kind of like a waterfall. So that's another issue that we want to treat. And finally, the implants are textured anatomic implants. These do have a potential risk of cancer called ALCL. And so the plan is to remove her implants, remove the scar tissue surrounding her implants, and to do a lift, all to make her smaller, to make her more lifted on her chest, and to reduce her risk of this rare type of cancer. Now let's take a peek at her markings for the operation. Here are her markings for the surgery, and what we're going to do is we're going to do a redo of her lift. She already has the scars that go around, down, and underneath, and I'm going to take a bit more skin out, and you can see her implant is sitting up here and up here. That's the waterfall deformity. So I'm going to get rid of the implant, we're going to remove the scar tissue around it, and then lift what else she has left. Here are the implants that we took out. They are textured implants that were intact. They're silicone, and they both came out without any problem at all, along with the scar tissue. Her surgery is all done. Everything went really, really well. We took out her implants, which were completely intact, as well as the majority of the scar tissue on the inside. Did her lift. She does have scars that go around the areola, down underneath. These little tiny holes and stuff that you see, all that's going to heal and go away. The drains come out in 1 week, and I think in the end she's going to have a real nice shape. We're now about 2 months after her surgery. She's healing really, really well. So her implants were taken out, and we did the lift. She does have a scar that goes around her areola, down, and there's some underneath as well. Her breasts are reshaping on their own, which is really nice. As time goes on, they are going to narrow a bit. The shape is going to continue to improve, but she's back to completely normal activity, and excited for her not to have these implants anymore.